everyone. I thank you for coming today. I am going to talk to you about healthcare reform. It is my opinion it's a mistake for America. Have you ever had an experience at the ER, maybe with family members or yourself? Did you receive immediate attention, a sense of peace at knowing you were going to be well cared for by highly trained medical doctors and nurses, and that they would be doing diagnostic testing right away to receive a better idea of how to care for you? I want to inform you that they're looking at the Canadian healthcare reform and the France healthcare, that there is a change coming to America with our healthcare reform that's being introduced to us. In Canada, the sick, they are lined up, laying on stretchers, sitting and waiting many of days just to be admitted into the hospital. The foul smell in the air of sweat and urine is so bad that it takes your breath away. Surgery or cancer treatments such as chemo and radiation, or even just having an MRI done, a wait time for that is 4 months to from 2 to 3 years even. People in other countries such as Canada are coming here to America to seek medical help that they're not receiving in their own country. A report done by Dana Bush and Lisa Jansen from CNN reporters, they interviewed a woman named Shauna Holmes. She suffered with severe headaches and vision problems, and she went to see her family doctor there in Canada, and he tried to get her in to see a specialist who could give her better care, but the wait time would be 4 months or more. So she decided to come here to America, to the Mayo Clinic in Arizona, and that is where the doctors there diagnosed her with having a brain tumor. The doctors at the Mayo Clinic also contacted those specialists in Canada, trying to get her in to see them and telling them the urgency that she needed to have the surgery done right away to remove this tumor. But they are unable to get her in due to the healthcare reform that has taken place in Canada. So Shauna Holmes and her husband went back to Canada. They sought out friends and family members to borrow money from. They mortgaged their home to pay for a $100,000 surgery that can save her life, which she must have, according to what the doctors at the Mayo Clinic told her, that if she did not have the surgery, that she would go blind and even at the worst die. Healthcare reform is a mistake. Some of the issues that will take place in our healthcare reform is the quality of care that we could even receive. There will be waiting list and a cost inflation. Private insurance will increase for those who can even afford it, and taxation, which is already overwhelming for many of us. Government programs have already failed, such as Social Security and have gone bankrupt. The Social Security for my children, which are the generation of millennium, when it's time for them to retire, there will not be any money in the Social Security for them to retire on. And the senior citizens now, the Medicare and Medicaid are ending. The payment that they receive from Medicare is having a major reduction in it. The benefits are decreasing. There will be effective in 2011 tax on drugs and on medical devices. This is all thanks to this government health reform that has been passed. Some of the problems that have been faced in Canada and France is the medical classes for their nurses and doctors for training them has been reduced. They cut them in half. The hospitals are not being adequately funded, and the doctor's fees are being capped, and which leads to a shortage of doctors and nurses, and the doctors are being limited to the treatment that they can provide. And the hospitals there are way beyond the capacity to hold any new patients. According to the Washington Post here in our own country, we are facing a shortage of doctors here. The baby boomers are getting ready to retire, which is many of our doctors are in that age. So even though we've already are seeing a shortage, there will be more of a shortage from them retiring. The Heritage Foundation says that 15% of hospitals is likely to go out of business due to this health care because of all the demands it will put on them. Who will pay for this? Most likely it will be me and you, the taxpayers, the working class. What can be done? We need to contact our representatives, call them, tell them to stop this health care reform, to undo the damage that they've already done with just what they passed with Medicare. We need to stand and have strong issues against this. We need to get out and vote this coming November election for candidates who will fight on our behalf and stop the health reform from taking place here in America. Let your friends and family know. Tell them to vote. Tell them to find out, to get involved and learn more about what's going on here in our own country before it's already too late, as like it is in Canada, where we may end up seeking medical help and having to put our homes up for mortgage. I thank you all for coming today, and I can share any more information with you that you'd like to know about. Please see me afterwards. Thanks.